Before the governor was elected, he had said that the health care of the people are topmost in his mind. And so that whenever he was given the opportunity, he would be interested in how the average man on the street will benefit from healthcare services. And let me also say here that the Adeleke family has been known to be a family that gives health care to individuals. They spent millions of naira to take care of people both here in Nigeria and abroad. So it's not a strange thing to them. And that may answer the second question. How politicized is this? It wasn't a political matter. It was about something that they've been doing at the private level. And in fact, haven't been given this opportunity to reach out to more people. Let's go in. And so, as at the time the governor asked us to come together, he had been elected governor. So he wasn't campaigning. So we can't really say that this is politics. He had that mindset that, look, he wanted to reach out to the people of Osun State. He wanted to treat a lot of people in Osun State who had been unable to take care of their health because of the financial problem. So when he came in, he set up a committee, and he asked me to lead the committee to say, look, go and look at the common things that people suffer in the state, and let me know what we can do to address this. And that was exactly what we did. In the past, the previous outreach that previous government have done had always been on surgery of the general body. And we looked at that and said, look, that is insufficient. And we have the teaching hospital, we have the health management board to take care of more people in different forms. And so, rather than just one part of the care, what we did was to say, okay, these general surgical cases are going to be taken care of. But in addition to that, we will also take care of the eye. Okay, so we did surgery of the eye, remove cataract, remove pterygium, and then we gave glasses to people who needed glasses. And then we now went to people who have medical problems, hypertension, diabetics, and give them free drugs. And we presented that to him, and immediately he approved and released money to ensure that this was done. And that was what we did the first time and the second time. So, to answer your question again, it is not politics, it's not a political thing, it's something that is born out of the governor's care, the governor's concern for the people of Osun State. The experience was awesome. People throughout benefited widely. The first group we had about 25,000. Second phase we have about 25,000. So we have about 50,000 who have benefited in different forms in this program. Commonest program surgically that we took care of was hernia, which is common among old people as well as even the young children. So we have children with hernia, children with hydrocele. So that's the commonest thing that we did in general surgical cases. Of course, we have others like lump in the breast, swellings on the surface of the body, and all that. In the eye, the commonest problem that we attended to was cataract. Quite a lot of people presented with cataract, and they had their cataract removed and their vision restored. Hypertension is also one of the commonest in the medical care, and we saw a lot of people with hypertension and a lot of people with diabetic mellitus who were taken care of during this Himalayan outreach. So it was an idea from a man who loves his people and who desires to touch them. It's not a political thing. And he handed over this program to professionals. All the 10 members of the committee that he set up were purely doctors, nurses, pharmacists, laboratory scientists, professionals. There were no politicians among the group that organized this program, and he left us to run it. He just asked, what do you need? We presented that, approved it, released it, and allowed us to run it. So irrespective of who you are, where you are, whether you are a Christian or Muslim, whether you are APC or PDP, nobody talked about anything politics. So everybody who came, indeed people came from the government state, and they were all attended to. And I must say here, ladies and gentlemen, that our governor, Senator Ademola Adeleke, has done tremendously well for us. There are, I classify them as two type of JAPA. There's the internal JAPA and the external JAPA. The internal JAPA is that people move from state hospital to federal hospital. Okay, because the salary at the federal hospital is better. For example, people can move from our teaching hospital and go to Ife because that salary is better. But the governor has done something and approved the payment of allowances, hazard allowances, and all allowances, that indeed somebody in our hospital, in the teaching hospital here, may even have slightly higher salary than the federal institution. And so we must commend our governor for this. And this has helped us tremendously to keep our workers within. Okay, of course, we cannot restrain them from going for the external JAPA. But as far as the internal JAPA is concerned, the governor has been militated against that by his action of approving allowances that are agreeable to people in federal institutions. 100% sponsorship of human-led medical outreach is by the government of Governor Ademola. No dime from anywhere else. Nothing, not a single cover for now. We desire it. If there are donors who want to be part of it, it will be great. For example, the next phase we're looking at is cervical cancer, screening patients for cervical cancer. We're looking at bringing dental care into it also. Okay, so we want to expand it for more people to benefit. It's going to cost a lot of money, and if somebody can help the government, why not? We will appreciate it. But as far as the first and second ones that we did was concerned, there was nothing from anywhere except this government. There are people, for example, at the local level, we found out who had hypertension, who knew they had hypertension, who couldn't pay for the hypertension drug, and that's a problem. You have sometimes you see somebody, a blood pressure that shouldn't be more than 140/90. We check the blood pressure, it is 230/180. Mm-hmm. And we saw quite a lot like that. Mama, don't you know that you are hypertensive? Say, I know Moropotiloni. Or, sorry, I don't have money to buy drugs. So the governor also took note of that. And that was one of the reasons why the governor set up the elderly retirees for OIS, which the governor just launched about a week or so ago, that he wants to attend to, not just those who are in the service, but even after retirement, you can still be taken care of. So the governor is proactive. The governor is forward-looking and is looking more and more at how to help more people, how to bring in more people to help more people. So the governor is really working on that.